neonatal sepsis representing such a major health problem in low and middle income countries, it is still unclear how, when and where newborn babies acquire life-threatening infections. Furthermore, the factors associated with the presence of AMR in these cases are also still being elucidated. For example, there have been no studies in LMICs examining whether the presence of antibiotic-resistant bacteria in mothers is linked to the development of sepsis in their newborns. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman and today I'm going to talk about early life acquisition of antimicrobial resistance in newborn children from low and middle income countries. In a new study published in Nature Microbiology, Dr. Maria Carvalho, Dr. Kirsty Sands, and a network of international colleagues decided to look at the presence of antibiotic resistance genes or ARGs in the gut microbiota, the collection of microbes that are present in the human gut of mothers and their babies from 7 LMICs in Africa and South Asia. They recruited 35,040 mothers and 36,285 neonates from LMICs. From these, they collected 18,148 rectal swabs which were used to grow the bacteria present in these samples and assess the presence of clinically important ARGs in the microbiota of mothers and their babies. The authors found that a large number of samples carry genes linked to antibiotic resistance, suggesting that AMR is far more widespread in these settings than previously anticipated. For example, samples from around 1 in 5 neonates or 18.5% were positive for BLA-NDM, a gene that encodes New Delhi metallo-beta-lactamase, which is an enzyme that can destroy beta-lactam antibiotics, including the commonly used carbapenems, resulting in the bacteria being resistant against the drug. Importantly, the researchers found that ARGs were present in neonates within hours of birth, indicating that initial colonization of newborns with antibiotic-resistant bacteria occurred at birth or soon after, likely through contact with the mother or from the hospital environment. The study highlights that better understanding the routes of ARG transmission, including mother to child and within the clinical environment, is essential to prevent neonatal sepsis. Finally, the results reinforce the importance of access to safe water, sanitation, and good hygiene to reduce AMR and lower neonatal sepsis and mortality rates in low and middle income countries. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.